When we perform a facelift in a male, it's done a little different than it would be in a female. Typically in a facelift, say a female, we'll start our incision up in the hairline, up here in the scalp, come down just up to the ear, maybe inside the ear like this to conceal it, behind the ear in the groove, and back in the hairline. Because men have shorter hair, it's more challenging to try to conceal those scars. And so it's very important when we look at a man that we take that into consideration. The other thing about the male facelift is the sideburn. Obviously women don't have sideburns, and if you look closely at the sideburn, you have the ear, you have a small space that's empty of hair, and then the sideburn itself. If we pull the skin back, as we do in a female, we may draw that sideburn skin into the ear area, which would be not ideal for a man. We can still make the same incision as we would in a female and still draw that skin back if we take the time during the procedure to try to destroy the hair follicles along this area that we want to become bare. Other ways of doing it are to angle the incision in such a way that it follows the exact hairline of the male. Anytime we do a male, we also worry about bleeding. The face has a great blood supply, but men have even more blood supply in it than females. The extra blood supply is there to help support the metabolism necessary for beard growth. And so male facelifts have a slightly higher tendency to have post-operative bleeding complications. Those complications are rare to begin with, but slightly more likely in a male. And so it's very important to consult the male and tell them and impress upon them how important their post-operative care is, and to avoid anything that would increase the blood pressure in their face and consequently lead to bleeding.